Waheguru Ji Ka Khalsa, Waheguru Ji Ki Fateh. Welcome to Sangat Health, a show about health for the Sangat by the Sangat. Mera naam hai Parminder Kaur Bhopal. The ਅੱਜ ਦਾ show ਹੈਗਾ ਆ care of the elderly. ਤੇ ਮੇਰੇ ਨਾਲ ਬੈਠੇ ਹੈਗੇ ਆ Dr. Reshma Sahed. He's a GP in the local community. She also ਜਿਹੜੇ ਹੈਗੇ ਆ ਹੋਰ ਡਾਕਟਰਾਂ ਨੂੰ clinical supervisor ਹੈਗੇ ਆ training ਵਾਸਤੇ, ਤਾਂ medical referee ਹੈਗੀ ਆ Thames View crematorium ਵਾਸਤੇ. ਨਾਲੇ also ਮੇਰੇ ਨਾਲ ਬੈਠੀ ਹੈ ਭੈਣ ਜੀ ਬਲਵਿੰਦਰ ਰਥੋਰ, who specializes in the care of the elderly in the local Gravesend community.
So basically when the blood vessels in the brain are affected, you will have small vessel disease, and this tends to affect your normal day-to-day thinking skills, so you're not able to think properly. People can present with personality changes. Sometimes they can have movement disorders, so they can be confused to a certain extent with someone who might be having a stroke. So some people have symptoms of strokes. Some people may actually be developing vascular dementia. Third type, I would say, is something called dementia with Lewy Bodies. So this is something that is found when once people have been scanned, they've had an MRI brain scan, you'll see this sort of Lewy Bodies in the brain. Now, these kind of people would have a change in alertness. They have movement problems. They may present with hallucinations, so seeing things that aren't there, and they can often have sleep disturbances. And the last type, I would say that's quite important, is frontotemporal dementia. And these people clearly have personality and behavior changes. So basically this is affecting the front of the brain, and this is where this comes about. They tend to have a lack of hygiene. Okay, so when you find someone who's got memory problems, lack of hygiene, they don't take care of themselves at all, and you know the normal kind of social norms that they would have, they don't have that either. Their language deteriorates. They don't recognise their family. These are the type of people that have that type of dementia.
Okay, so ਜਦੋਂ ਇਹ dementia ਦੀ problem ਹੋ ਰਹੀ ਆ ਤਾਂ ਫਿਰ ਆਪਾਂ ਪਤਾ ਕਿੱਦਾਂ ਲੱਗਦਾ ਵੀ ਇਹ ਬਿਮਾਰੀ ਤੁਹਾਨੂੰ ਹੈਗੀ ਆ, ਹਨਾ? ਤਾਂ ਇਹ ਹੁਣ ਆਪਾਂ ਪੁੱਛਣਾ ਆ. So how is dementia detected? I mean, how would you know? I mean, we've talked about the sort of, you might have forgetfulness, you might have not take care of yourself, social height, not. So if you're somebody who gets up every morning, combs your hair, gets ready, and then all of a sudden that starts declining. So how would you know? I mean, there's the visual signs, but is there any other tests that you can do?
Yes, so I would say that you would need to bring your family member or your relative in to see the GP. I mean, we need to do formal sort of memory testing, and that's quite easily done. We do a sort of a word questionnaire which we go through, a couple of questions, and the classic test that we use is a 6-item cognitive test. So we go through that. And this is why it's important, as Dr. Jasvir has said, you need to bring in your relative with you to help translate. We do have translators, we can get that on board, but in order for us to get a proper memory test, we can do that. That gives us a very good assessment, actually, of whether we actually need to refer you on to a memory clinic, because these are very key questions.
So why do they not come? So the question is, in the Sangat, memory ja rahi hai buzurg di. Because why do we not bring them in? Why does the buzurg not want to go to the doctor? Why does the family not want to take the buzurg to the doctor? Ki masle ho sakde the? Kaiyan hunda hai ki assi chaਹੁੰਦੇ ਨਹੀਂ ਕਿ ਪਤਾ ਲੱਗ ਜੇ ਕਿ ਪਾਪੇ ਦੀ ਹੁਣ memory ਜਾ ਰਹੀ ਹੈ. ਇਹਦੇ ਸਮਾਜ ਦੇ ਵਿੱਚ ਬਹੁਤ ਇੱਜ਼ਤ ਸੀਗੀ, ਸਾਰਿਆਂ ਨੂੰ ਪਤਾ ਲੱਗ ਜੂਗਾ, ਮਖੌਲ ਉਠਾਓਗੇ. ਸਹੀ ਹੈ ਨਾ ਗੱਲ? ਇਹ ਆਪਾਂ ਗੱਲਾਂ ਭੁੱਲ ਜਾਣੀਆਂ. The other reason is that pata lag gaya, then somehow his status, his position in the family will be threatened. So it's some of those aspects we need to talk about. ਆਪਾਂ ਨੂੰ ਨਾ ਇਹਨਾਂ ਨੂੰ ਦੇਖਣਾ ਚਾਹੀਦਾ ਕਿ ਇਹ ਡਰ ਦੇ ਜਾਂ ਇਹ ਜਿਵੇਂ ਨਾ ਝੂਠੇ ਹੌਂਸਲੇ ਇਹ ਕੋਈ ਕੰਮ ਦੇ ਨਹੀਂ ਹੁੰਦੇ ਹੈਨਾ ਤੁਸੀਂ ਕਹਿ ਦਿਓ ਪਾਪਾ ਜੀ ਤੁਸੀਂ ਠੀਕ ਹੋ ਆਪਾਂ ਬਸ ਚੈੱਕਅਪ ਕਰਨ ਵਾਸਤੇ ਚੱਲੇ ਆ ਡਾਕਟਰ ਕੋਲੇ ਹੈਨਾ ਉਹਨੇ 2-3 ਗੱਲਾਂ ਪੁੱਛਣੀਆਂ ਆ ਆਪਾਂ ਨੂੰ ਹੈਨਾ ਆਪਾਂ ਵਾਪਸ ਆ ਜਾਣਾ because the key with dementia with mental health illness ਤੁਸੀਂ ਇਹ ਨਹੀਂ ਕਹਿਣਾ ਕਿ ਭਾਪੇ ਕੀ ਹੋ ਗਿਆ amma ki ho gaya even you don't make the person anxious you don't make the patient anxious ਤੁਸੀਂ ਕਹਿੰਦੇ ਬਸ ਠੀਕ ਆ ਪਾਪੇ ਦੀ ਅਪਾਇੰਟਮੈਂਟ ਬਣਾਈ ਸੀਗੀ ਹਨਾ ਪਾਪਾ ਜੀ ਦੀ ਤੇ ਅਸੀਂ ਜਾ ਕੇ ਉੱਥੇ ਡਾਕਟਰ ਕੋਲ ਜਾਣਾ now when you go to the doctor you've got to be able to tell them 2 or 3 things that you're a bit concerned about hana ki memory he's not like this give an idea help the doctor's got 5 to 10 minutes to see you 5-10 ਮਿੰਟ ਹੁੰਦੇ ਆ ਨਾ ਹੁਣ ਇਹ ਸ਼ੋਅ ਇਹ ਹਮੇ ਸਾਰੇ ਸਮਾਜ ਦੇ ਵਿੱਚ ਜਾ ਰਿਹਾ ਹੈ we're in the UK we're lucky we've got a primary care system and we've also got a secondary care hospital system ਜਿਹੜੇ ਤੁਸੀਂ ਆਪਣੇ ਪੰਜਾਬ ਦੇ ਵਿੱਚ ਹੋ ਜਾਂ ਬੰਗਲਾਦੇਸ਼ ਦੇ ਵਿੱਚ ਹੋ ਜਾਂ ਪਾਕਿਸਤਾਨ ਦੇ ਵਿੱਚ ਹੋ ਜਾਂ ਹੋਰ ਕੋਈ ਕੰਟਰੀਆਂ 'ਚ ਬੈਠੇ ਹੋ ਤੁਹਾਡੀ ਵੀ ਸਿਸਟਮ ਹੈਗੀ ਹੈ ਪਰ ਪਹਿਲਾਂ ਇਹ ਹੁੰਦਾ ਕਿ ਇਹਨੂੰ ਥੱਲੇ ਨਹੀਂ ਦਫਨਾਉਣਾ ਕਾਰਪੇਟ ਦੇ ਥੱਲੇ ਨਹੀਂ ਕਰਨੀ ਗੱਲ ਖੁੱਲੀ ਹੋ ਕੇ ਕਰੋ ਪਰ ਸੈਂਸਿਟਿਵਿਟੀ ਇਹ ਹੈ ਕਿ ਉਹ ਬੰਦੇ ਨੂੰ ਪਤਾ ਨਾ ਲੱਗੇ ਕਿ ਤੈਨੂੰ ਉਹਨੂੰ ਫਿਕਰ ਨਾ ਲੱਗੇ ਹਾਂ so just saying thank you
yeah so I mean it is important to do that and I think yes dementia is one of the reasons why you could be losing your memory but obviously because you've come in for this we do a whole load of blood tests and that might actually indicate that you have some other medical problem. You know, it might not just be dementia, it could be something else that's actually causing you to not function as well. So we tend to do sort of blood tests, we do urine test, we do an ECG, and then based on that, then we will then refer you to the memory clinic. So in some places they call it the memory clinic, other places it's called community age psychiatry clinic. So, and I will refer you to either of those two, or if I think it's some other neurological condition, then I'll send you to neurology clinic in hospital.
I think the key message here is noticing. So, you know, your older mum or dad or ਉਹਨਾਂ ਨੂੰ ਸ਼ਾਇਦ ਪਤਾ ਨਹੀਂ ਮੈਨੂੰ ਜਾਣਾ ਚਾਹੀਦਾ ਕਰਕੇ ਉਹਨਾਂ ਦਾ ਤਾਂ ਚੇਤਾ ਚਾਹੀ ਜਾਂਦਾ ਹੈ ਹਨਾ ਤਾਂ ਜਿਵੇਂ ਆਪਾਂ ਜਦੋਂ ਅਸੀਂ ਦੇਖਦੇ ਹਾਂ ਸਾਡਾ ਫਰਜ਼ ਬਣਦਾ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛਣਾ ਵੀ ਕੀ ਗੱਲ ਆ ਜਾਂ ਉੱਦਾਂ ਜੇ ਸਾਨੂੰ ਜਿੱਦਾਂ ਸ਼ੱਕ ਪਈ ਵੀ ਕੋਈ ਗੱਲ ਆ ਤਾਂ ਆਪਾਂ ਉਹਨਾਂ ਨੂੰ ਨਾਲ ਲੈ ਜਾਈਏ ਤਾਂ ਡਾਕਟਰ ਦੇ ਨਾਮ ਬੁਲਾ ਕੇ ਤਾਂ ਉਹ ਐਕਸਪਰਟ ਹੈ ਉਹ ਤੁਹਾਨੂੰ ਦੱਸ ਦਵੇ ਫਿਕਰ ਕਰਨ ਦੀ ਕੋਈ ਗੱਲ ਨਹੀਂ ਹਨਾ So we talked about dementia and you could do a possible referral to a memory clinic. What happens at the memory clinic?
Yeah, so a lot of people get worried about what kind of investigations might happen. I mean, usually what the criteria is that they need to do some kind of imaging. So MRI of the brain is classic, and that will actually determine what kind of dementia you might have. They will also take another history as well, and they'll look at all our blood results, and then they'll come to a diagnosis. Okay, and then they will give you an idea of your prognosis as well, how long advanced it is, how long it will take, you know, and progression. And this is very important because they have to go very slow at explanation. So, and that's why it's very important for you to bring your relative along to, you know, to understand all of this as well. They may prescribe some kind of medication for the dementia, but you need to note that this isn't curable. It's not a curable condition. It can delay it, but it's not curable. And then the other things that are important is you will need to go on to do various other things. So you might have to inform the DVLA if you're driving. The DVLA will then contact us, and obviously we have to write the condition that is given to us by the memory clinic, and a lot of people get a bit worried about that side of things because they do come to us because they're worried that their license is being revoked. We can't do anything about that, unfortunately. And then family, you need to discuss this with family. You know, you need to have a lot of discussion because there has to be some advanced care planning. And the reason for that is because, you know, you might have good memory, good brain function at the moment, but later on you won't, and family members are responsible for that. So I would go to a solicitor, and you need to get a lasting power of attorney for health and welfare, so that you can have all these things in place so that there are no problems in the future.
So power of attorney health वास्ते भी हुंदी है, power of attorney जायदाद वास्ते भी हुंदी है, properties etc. So there are two different factions. So one family member can have both, or you can have different family members, है ना? So ਆਪਾਂ ਨੂੰ ਦੇਖਣਾ ਪੈਣਾ ਕਿ ਜੇ ਤੁਸੀਂ ਪਲੈਨਿੰਗ ਨਹੀਂ ਕੀਤੀ ਨਾ, ਨਹੀਂ ਤਾਂ ਟੈਕਸ ਵਾਲੇ ਨੇ ਲੈ ਜਾਣਾ ਸਾਰਾ। ਤਾਂ ਨਿਆਣੇ ਵੀ ਸੋਚੋ, ਜੇ ਤੁਸੀਂ ਬਜ਼ੁਰਗਾਂ ਦੇ ਨਾਲ ਬਹਿ ਕੇ ਗੱਲਾਂ ਬਾਤਾਂ ਨਹੀਂ ਕੀਤੀਆਂ ਫਾਈਨੈਂਸ ਦੀਆਂ, ਜਾਂ ਬਜ਼ੁਰਗਾਂ ਨੇ ਨਹੀਂ ਕੀਤੀਆਂ ਨਿਆਣਿਆਂ ਦੇ ਨਾਲ ਡਰਦੇ ਹੋਏ, ਉਹ ਟੈਕਸਮੈਨ ਨੇ ਲੈ ਜਾਣਾ ਸਾਰਾ ਕੁਝ। ਤੇ ਸਾਰਿਆਂ ਨੂੰ ਇਕੱਠੇ ਹੋ ਕੇ ਗੱਲ ਕਰਨੀ ਪਹਿਲਾਂ ਉਦੋਂ ਕਰੋ ਜਦੋਂ ਸਾਰਿਆਂ ਕੋਲੇ ਆਪਦਾ ਹੋਸ਼ ਹਵਾਸ ਸਾਰਾ ਕੁਝ ਹੈਗਾ, ਹੈ ਨਾ? Family ਦੇ ਵਿੱਚ, you know, we need to, then the family children need to take care, because if you're discussing those aspects, you've got responsibility to look after the parents as well.
So these are sort of conversations that need to take place, and you know, there's a level of dignity to be had around for the actual individual who's got dementia, but also as carers. We've talked a lot about how you manage dementia, what dementia is. So I guess now, being in the Gravesend community, we're very, very lucky to have Bal Rathor here, who is a specialist in care in the community. So Bal, so what kind of care is available, and where do you go to find out about falls, rehabilitation, if there's a decline in mental mobility or you know, sort of the faculties of an individual? I mean, what are care coordinators? So, you know, ਜਦੋਂ ਆਪਾਂ ਹੁਣ ਜੇ ਕੁਝ ਹੋ ਗਿਆ, ਜੇ ਕੋਈ ਬੰਦਾ ਡਿੱਗ ਜਾਂਦਾ ਆ ਜਾਂ ਹਸਪੀਟਲ ਨੂੰ ਜਾਂਦਾ, ਜਦੋਂ ਹਸਪੀਟਲ ਤੋਂ ਬਾਹਰ ਆਉਂਦਾ ਸਿਆਣਾ ਸਰੀਰ, ਉਹਨਾਂ ਨੂੰ ਕਈ ਚੀਜ਼ਾਂ ਕਰਨੀਆਂ ਚਾਹੀਦੀਆਂ। ਤਾਂ ਫਿਰ ਜਦੋਂ ਹੁਣ ਘਰ ਵਾਲੇ ਵੀ ਸੋਚਦੇ ਵੀ ਆਪਾਂ ਕਿੱਦਾਂ ਕਰੀਏ, ਸਾਨੂੰ ਪਤਾ ਨਹੀਂ, ਬੈਲ ਨੇ ਸਾਨੂੰ ਦੱਸਣਾ ਆ, ਤਾਂ ਬਲਵਿੰਦਰ ਭੈਣ ਜੀ ਨੇ ਵੀ ਕਿੱਦਾਂ ਆਪਾਂ ਕਰ ਸਕਦੇ, ਤੇ ਕਿਹਨੂੰ ਜਾਣਾ ਇਹ ਵਾਸਤੇ। ਬੈਲ।
Thank you. So going back to like rehabilitation and falls and mobility issues in the elderly, if you go to see your GP or a family member takes you along to go and visit your GP, you are referred to an occupational therapist. So an occupational therapist is someone that will work close with social services or your care manager, and they aim to improve your ability to help you conduct everyday tasks as much as possible if you're experiencing difficulties. So an OT can help you with physical disabilities, recovering from short-term illnesses, or if you've had an operation, and if you just need some adaptations at home, referring back to mobility adaptations. So you might need some grab rails put up, or a raised toilet seat, or an electric bath seat, so you can still be independent at home and carry on with tasks and activities on a daily basis. Also, they can help you with your mental health issues, and again, just generally getting older and adaptations to getting older and helping you to remain independent. Also, in our local area, we have rehabilitation clinics which help people to, if they've had any minor health issues or operations, again, they can be admitted into these rehabilitation clinics where you're helped with to regain confidence and build up your confidence again to remain with your daily tasks. So you're gaining that confidence to go back home after a couple of weeks, and you can carry on with daily tasks with any additional support. And you have trained physiotherapists available at these rehabilitation centres as well.
So where can you get more help from? If you needed to get some more help, where's the first point of call to both of you, really?
Okay. So I would say the first point of call would be you can either contact your GP, who can signpost you out to social services or a care organisation. If you contact social services, they would usually come out and they'd conduct a needs assessment. So the needs assessment would really determine what type of care you need and what sort of support you need. And from there, they conduct a financial assessment as well, which determines if people can get financial support from social services, or are they going to be a self-funder, or is their care going to be partially funded. So there's lots of aspects around that, but it's usually when social services come out, you're assigned to a care manager and they help you to filter through the system. And that's where people like us as a care organisation come in, either social services will contact us to say we've got so-and-so and they need care needs, can you go out and assess this client? Or again, if they don't meet the criteria and they're self-funders, then again they're signposted to care organisations that can step in, go out, meet the family, do an initial needs assessment and assess their needs and just see what type of care they need and how many times a day they require support from support workers.
What's the big problem with actually accessing and going and actually asking for your help to come in the first place? So what's in the Punjabi community, because we're going out to the Punjabi, है ना, Punjabi ਦੇ ਵਿੱਚ ਆਪਾਂ ਨੂੰ ਥੋੜਾ ਜਿਹਾ ਇਹ ਦੱਸੋ ਕਿ ਕਿਉਂ ਨਹੀਂ ਆ ਰਹੇ?
I don't know if that's a Punjabi. Yeah, I think it's a lot to do with, first of all, I would say language barrier, because I do have clients that receive services from us, but language barrier is a really big issue, because if they haven't got any family members behind them to support them, it's like they really don't know where to go, where to find the help. And if you've got support staff that speak the Punjabi language, then we can encourage people to take services from us, because you'll be visited from a Punjabi speaking support worker every day, or a small group of support workers, to build that rapport with the service user. And I would say also it's financial as well. People are affected. How much money do I need to pay out for my care? How much is it going to cost me? Again, this is something they can talk to social services about and have the financial assessment conducted.
ਇਹ ਥੋੜਾ ਜਿਹਾ ਇਹ ਹੁੰਦਾ ਨਾ ਕਿ you don't have to ਇਹ ਨਾ ਸੋਚੋ ਕਿ ਪਾਪਾ ਜੀ ਨੇ ਸਾਰੇ ਇੰਨੇ ਪੈਸੇ ਇਕੱਠੇ ਕੀਤੇ ਆ ਪੂਰੀ ਜ਼ਿੰਦਗੀ ਤੇ ਹੁਣ ਜੇ ਸੋਸ਼ਲ ਕੇਅਰ ਸਰਵਿਸਿਜ਼ ਨੂੰ ਬੁਲਾ ਲਿਆ ਉਹਨਾਂ ਨੇ ਸਾਰੇ ਲੈ ਜਾਣੇ। ਤੁਸੀਂ ਇਹ ਪਹਿਲਾਂ ਸੋਚੋ ਕਿ ਲੋਕ ਜੇ the finance side assessment ਦਾ ਇਹ ਨਹੀਂ ਮਤਲਬ ਹੈਗਾ ਕਿ ਇਹਨਾਂ ਨੇ ਤੁਹਾਨੂੰ ਦੇਣਾ। ਜੇ assessment ਤੁਸੀਂ ਕਰਾਈ ਨਹੀਂ ਨਾ, ਤੁਹਾਨੂੰ ਪਤਾ ਹੀ ਨਹੀਂ ਲੱਗਣਾ ਕਿ ਉਹ ਬਜ਼ੁਰਗ ਨੂੰ ਚਾਹੀਦਾ ਕੀ ਆ। So what it is, you can buy in certain services. You can, it's not like the older money, right? So you can buy in certain services, certain things are available to you, but ਜੇ ਤੁਸੀਂ ਪੁੱਛਿਆ ਹੀ ਨਹੀਂ ਨਾ, right? ਉਹਦੇ ਵਿੱਚ ਜ਼ਿਆਦਾ ਪ੍ਰੋਬਲਮਾਂ ਆਉਂਦੀਆਂ ਹੈ। ਬਜ਼ੁਰਗ will get more unwell. He'll become more of a problem at home, right? And then we'll be going to the GPs and the hospitals.
Dr. Rashmi, is there anything that you want to add to that about it's clearly a complex issue. So if you've had a fall and you've been in hospital, then there's a bit more support as you're coming out, or you know who to contact. If you have had a sort of steady decline at home and you've visited the GP, how do you sort of navigate these things, or what's the first point of call, really?
Yeah, so the patients that we're worried about, they get highlighted, and we do have these multi-disciplinary team meetings where we meet up with all sorts of aspects of healthcare and social care. So we'll have mental health workers come in, OTs, Imago, Age UK. We do have care coordinators, and then we can sort of discuss the case, and they can then go out and actually speak to the family and the individual and see what kind of benefits that they would require as well. So a lot of the elderly aren't claiming all the benefits that they need. I would say with the social care assessment, that is free for everyone. So you can access that. The assessment itself is free. So, and everyone is entitled to free social care to a certain limit. So everyone can access that. The other kind of things that they've developed, I'll show you this. There's a Kent Care Services Directory. And for every region, they've developed this. So this is a very good port of call to actually access all aspects of care that you might require. So I have asked them whether they will do this in other languages. They haven't as yet, but perhaps as a community we can try and persuade them to actually translate that into a different language.
So ਜੇ ਆਪਾਂ ਹੁਣ ਜਿੱਦਾਂ ਕਮਿਊਨਿਟੀ ਵਾਸਤੇ ਜਿੱਦਾਂ ਆਪਾਂ ਹੈਗੇ ਆ ਕਾਫੀ ਜਿੱਦਾਂ ਕਈ ਲੋਕੀ ਜਿੱਦਾਂ ਹੁਣ ਸਿਆਣੇ ਹੋਈ ਜਾਂਦੇ ਆ ਤਾਂ ਕੋਈ ਪ੍ਰੋਬਲਮਾਂ ਹੁੰਦੀਆਂ ਆ ਘਰ ਦੇ ਵਿੱਚ ਵੀ ਹੁੰਦੀਆਂ ਜੇ ਕਈ ਲੋਕਾਂ ਨੂੰ ਜਿੱਦਾਂ ਹੁਣ ਇਕੱਲੇ ਰਹਿੰਦੇ ਆ ਤਾਂ ਕੋਈ ਜੇ ਡਿੱਗ ਪੈਂਦੇ ਆ ਤਾਂ ਡਾਕਟਰ ਨੂੰ ਜਾਣਾ ਪੈਂਦਾ ਆ ਗੱਲ ਇਹ ਹੈ ਕਿ ਆ ਸਪੋਰਟ ਸਰਵਿਸਿਸ ਸਾਰੇ ਹੈਗੇ ਆ ਪਹਿਲੇ ਤੁਸੀਂ ਡਾਕਟਰ ਨੂੰ ਜਾ ਸਕਦੇ ਆ ਪਹਿਲਾਂ ਪਤਾ ਲਾਉਂਗੇ ਤੇ ਕੀ ਹੈਗਾ ਕਿੱਦਾਂ ਕਰਨਾ ਜੇ ਤੁਸੀਂ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਫੋਲ ਹੋਇਆ ਆ ਤਾਂ ਉਹ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਟੀਮ ਹੈਗੀ ਆ ਉਹਨਾਂ ਨੇ ਤੁਹਾਨੂੰ ਦੱਸਣਾ ਆ ਤਾਂ ਉਹਨਾਂ ਨੇ ਇਨਵੋਲਵਮੈਂਟ ਕਰੋਗੇ ਜਿੱਦਾਂ ਡਿਫਰੈਂਟ ਕੇਅਰ ਸਟਾਫ ਦੇ ਵਾਸਤੇ ਵੀ ਤੁਹਾਨੂੰ ਕੀ ਘਰ ਚਾਹੀਦਾ ਤੁਹਾਡੇ ਤੁਸੀਂ ਇਕੱਲੇ ਰਹਿੰਦੇ ਘਰ ਆ ਜਾਂ ਤੁਹਾਡੇ ਕੋਈ ਘਰ ਹੈਗਾ ਆ ਵੀ ਜਿਹਨੂੰ ਅਸੀਂ ਦੱਸ ਸਕਦੇ ਕਰਕੇ ਉਹਨਾਂ ਨੇ ਜੇ ਤੁਸੀਂ ਤੁਰਨ ਫਿਰਨੀ ਵਾਸਤੇ ਤਾਂ ਉਹਨਾਂ ਨੇ ਤੁਹਾਨੂੰ ਹਾਲੇ ਘਰ ਤੋਂ ਭੇਜਣਾ ਆ ਤਾਂ ਜਦੋਂ ਫਿਰ ਬੰਦਾ ਬਾਹਰ ਆਉਂਦਾ ਆ ਤੁਸੀਂ ਸੋਸ਼ਲ ਸਰਵਿਸਿਜ਼ ਦੇ ਨਾਲ ਤੁਸੀਂ ਜਿੱਦਾਂ ਕੇਅਰ ਕੋਆਰਡੀਨੇਟਰ ਬਲਵਿੰਦਰ ਭੈਣ ਜੀ ਨੇ ਤੁਹਾਨੂੰ ਦੱਸਿਆ ਆ ਕੰਟੈਕਟ ਕਰ ਸਕਦੇ ਆ ਤਾਂ ਉਹ ਤੁਹਾਨੂੰ ਦੱਸੂਗੇ ਵੀ ਤੁਸੀਂ ਕਿਹਨੂੰ ਜਾਣਾ ਆ ਚੀਜ਼ਾਂ ਵਾਸਤੇ ਜਿੱਦਾਂ ਕਈਆਂ ਨੂੰ ਇੰਕੌਂਟੀਨੈਂਸ ਅਸੈਸਮੈਂਟ ਕਰਨਾ ਪੈਂਦਾ ਆ ਪਹਿਲਾਂ ਵੀ ਪਤਾ ਲਾਉਣਾ ਚਾਹੀਦਾ ਵੀ ਕੀ ਗੱਲ ਆ ਆਕਿਊਪੇਸ਼ਨਲ ਹੈਲਥ ਵੀ ਆਉਂਦੀ ਆ ਤੁਹਾਨੂੰ ਆ ਕੇ ਦੇਖਣ ਵਾਸਤੇ ਤਾਂ ਇੱਕ ਮਿੰਟ ਮੈਂ ਹੁਣ ਚਾਂਸ ਦੇ ਪਾਸ ਕਰ ਦੇ
ਇੱਕ ਮਿੰਟ ਹੁਣ ਆਪਣੇ ਕੋਲ ਨਾ ਬਲਵਿੰਦਰ ਥੋਰ ਹੈਗੇ ਆ ਨਾ ਆਪਾਂ ਪੂਰਾ ਚਾਹੁੰਦੇ ਆ ਕਿ ਸੰਯੋਗ ਨਾਲ ਇਹ ਦੱਸ ਦੇਣ ਕਿ ਐਕਚੁਅਲੀ ਵਾਟ ਯੂ ਡੂ ਹਨਾ ਤੁਸੀਂ ਜਾਣਦੇ ਆ ਘਰ ਦੇ ਵਿੱਚ ਆ ਗਏ ਆ ਉਹ ਹੁੰਦੇ ਆ ਤੁਸੀਂ ਕੀ ਕੁਝ ਦੇਖਦੇ ਆ ਘਰ ਦੇ ਵਿੱਚ ਕਿਹੋ ਜਿਹੀ ਅਸੈਸਮੈਂਟ ਕਰਦੇ ਆ ਕੀ ਕੁਛ ਲੈ ਕੇ ਆ ਸਕਦੇ ਆ ਤੁਸੀਂ ਉਹਨਾਂ ਦੇ ਘਰ ਦੇ ਵਿੱਚ ਮੈਂ ਬਰਮਿੰਗਮ ਦੇ ਵਿੱਚ ਵੀ ਲੋਕਾਂ ਦੇ ਨਾਲ ਗੱਲ ਕੀਤੀ ਆ ਸਾਊਥ ਹਾਲ ਦੇ ਵਿੱਚ ਵੀ ਕੀਤੀ ਆ ਜਿੱਥੇ ਲੈਸਟਰ ਦੇ ਵਿੱਚ ਵੀ ਕੀਤੀ ਆ wherever you have large populations of Punjabi community you have a very well sourced source of local culturally sensitive ਆਪਣੇ ਜਿਹੜੇ Punjabi speaking people are there to deliver the service we are very lucky that in Gravesend you have something like that so I wanted to hear some of your experiences. You go into the house, you've stepped in the door, what do you look at? How do you do that?
Okay, so basically once we step into the door, we've had the initial call, a family member needs some support, i.e. from social services or from a main carer really from the family. So we go in, we have a look, we have an initial assessment of our own from our organisation that we conduct. So we have several questions on there that we ask. First of all, some background on the service user. And obviously we would like a next of kin present because if this person is suffering from some sort of cognitive impairment, they won't be able to answer all the questions relevantly. Yeah, anybody who's the main carer. Yeah. And then we have a source of questions that we ask. We look at what sort of services they need, what sort of decline they've had recently, what other healthcare professionals are involved in their care. So this could be district nurses, GPs, any consultants, just depending on their medical conditions. And then we conduct a risk assessment of the home as well because we have to make sure
risk assessment ਕੀ ਹੁੰਦਾ
so it's making sure the home is safe for our support workers to go in and work in there and to provide this support and care for the service user and again a risk assessment if we're using any equipment so this could be medical equipment involving a hoist a Zara steady
so ਜੇ ਉਹਨਾਂ ਤੋਂ ਤੁਰ ਨਹੀਂ ਹੁੰਦਾ
yes
ਜਾਂ ਉਹਨਾਂ ਤੋਂ ਸੀੜੀ ਨਹੀਂ ਚੜ੍ਹ ਕੇ ਉੱਤੇ ਤੱਕ ਨਹੀਂ ਜਾ ਸਕਦੇ
So they might have a stair lift.
Stair lift ho sakdi hai.
So all these things we conduct risk assessments on and have a look when they last were inspected. So they're safe for our care staff to use.
ਜੇ ਪਿਸ਼ਾਬ ਆਈ ਜਾਵੇ ਇਹ ਪ੍ਰੋਬਲਮ ਆ ਤੁਸੀਂ ਦੇਖੋ ਜਾ ਕੇ ਜੀਪੀ ਨੂੰ ਹਲੇ ਪਤਾ ਨਹੀਂ
Yeah, so we would do a referral to the GP or to district nurses, and then from there they're further signposted if they need catheters or incontinence pads. Again, we can organise all that for them.
So you look at everything going
The whole
on
aspect that's
in the
involved
house.
for the individual in the house, how we can support them to stay independent in their home.
So independent, ਕਈ ਇੱਥੇ ਆਪਣੇ ਬਜ਼ੁਰਗ ਉਹ ਆਪ ਘਰੇ ਇਕੱਲੇ ਰਹਿੰਦੇ ਆ. So how do we help people to stay living alone but with all the resource they need to remain independent?
Yeah, so this is what you get assessed from your care manager or from us. So they can stay home independently, but they might require one visit a day just for like medication administration. So just making sure they
So ਇਹ ਨਹੀਂ ਹੈਗਾ ਕਿ ਉਹ ਘਰੇ ਜਾ ਕੇ ਤੁਹਾਨੂੰ ਨਾ ਹੋਮ ਦੇ ਵਿੱਚ ਪਾ ਦੋਗੇ. ਇਹ ਨਹੀਂ ਗੱਲ ਹੈਗੀ. ਆਪਣੇ ਸਮਾਜ 'ਚ ਹਮੇਸ਼ਾ ਨਾ ਆਪਾਂ ਇਹ ਸੋਚਦੇ ਹਾਂ ਕਿ ਇੱਕ ਹਟੌਲੇ ਦੀ ਗੱਲ ਆ, ਇੱਕ ਚੀਜ਼ ਹੋਣੀ ਆ, ਆਹ ਹੋ ਜਾਣਾ. ਇਵੇਂ ਨਹੀਂ ਗੱਲ ਹੁੰਦੀ. ਗੱਲ ਹੁੰਦੀ ਹੈ ਤੁਸੀਂ ਉਹਨੂੰ ਫੋਲਾ ਫੋਲੀ ਕਰੋ, ਫਿਰ ਉਹ ਦੱਸੂਗੇ ਤੁਹਾਨੂੰ ਤਾਂ ਕਿ ਬੀਬੀ ਘਰੇ ਰਹਿ ਸਕਦੀ ਆ, ਬਸ ਇੱਕ ਵਾਰੀ ਦਿਨ ਦੇ ਵਿੱਚ ਉਹਨੂੰ ਚਾਹੀਦਾ ਆ ਕਿ ਇੱਕ ਵਾਰੀ ਕੋਲ ਨਰਸ ਆਉਂਦੀ ਆ, ਉਹ ਆਪਦੀਆਂ ਦਵਾਈਆਂ ਦੇ ਜੂਗੀ, ਬੀਬੀ ਨੇ ਠੀਕ ਰਹਿਣਾ, ਬੀਬੀ ਆਪਦੀ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਰਹੂਗੀ, ਬੀਬੀ ਆਪਦੇ ਘਰੇ ਰਹੂਗੀ, ਹੈਨਾ? So you try to do that.
We try to promote independence. It's not to take them out of their home. Our main aim is to remain them at home independent as possible. And again, it's like medication or meal preparations, or even take them shopping, to a gurdwara visit if they need that extra support, somebody with them, GP's appointment, hospital appointments.
So Sangat is in Gravesend, but there's no, ਤੁਸੀਂ ਜਿੱਥੇ ਵੀ ਬੈਠੇ ਹੋ ਦੁਨੀਆ ਦੇ ਵਿੱਚ, ਤੁਹਾਡੇ ਕੋਲੇ ਤੁਹਾਡੇ ਆਪਦੇ social worker ਵੀ ਹੈਗੇ ਆ, ਤੁਹਾਡੇ ਆਪਦੇ GP ਆ. They will direct you towards your local care. But we have a Punjabi speaking a person who's already doing great work in the community. It would be nice to get some tips, and maybe you could share those again on other shows going on in the future. And I'd just like to say a big thank you. Dr. Reshma Sayyid Aya, Avar Allah Noor Paya, Kudrat ke Sab Bande, Musalman, DP, Dr. ਆਪਣੀ ਸੇਵਾ ਕਰਨ ਆਈ ਆ, ਸਾਡੀ ਸੇਵਾ ਕਰਨ ਆਈ ਆ, ਗੁਰਦੁਆਰੇ ਦੇ ਵਿੱਚ ਗੁਰੂ ਨਾਨਕ ਦੇਵ ਜੀ ਦੀ ਸੰਗਤ ਕਰਨ ਤੇ ਤੁਹਾਡੀ ਸੇਵਾ ਕਰਨ. So Sikhi does not believe in, Sikhi is interfaith. Sikhi is about helping everybody in the world, every part of creation. So thank you everybody. ਸਾਨੂੰ ਦੇਖਦੇ ਰਹੋ ਤੇ ਤੁਹਾਡੇ ਬੱਚੇ ਆ ਜੀ, ਜੇ ਕੋਈ ਗਲਤੀਆਂ ਹੋ ਗਈਆਂ ਮਾਫ ਕਰਨਾ. ਇਹਨਾਂ ਨੇ ਤਾਂ ਕੋਈ ਗਲਤੀ ਕੀਤੀ ਨਹੀਂ, ਗਲਤੀਆਂ ਤਾਂ ਮੈਂ ਹੀ ਕੀਤੀਆਂ ਲੱਗਦਾ ਸ਼ਾਇਦ, ਹੈ ਨਾ? ਪਰ ਗੱਲ ਮੇਨਲੀ ਸਾਡੀ ਇਹ ਹੈ ਕਿ ਅਸੀਂ ਤੁਹਾਡੇ ਬੱਚੇ ਆ, ਤੁਹਾਡੀ ਸੇਵਾ ਕਰਨ ਆਏ ਆ. ਸਾਨੂੰ ਤੁਸੀਂ ਦੱਸੋ ਸੰਗਤ ਜੀ, ਤੁਹਾਡੀ ਸੇਵਾ ਕਿਵੇਂ ਕਰੀਏ. ਸੋ ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ.